This episode, we will discuss excretion of drugs. Excretion of drugs. There are some routes of excretion of drugs. Renal excretion, biliary and fecal excretion, excretion by other routes, for example, milk and lung. Renal excretion is most important. Drugs are eliminated from the body, either unchanged by the processes of excretion or converted to metabolites. Lipid-soluble drugs thus are not readily eliminated until they are metabolized to be more polar compounds. Let's look at the structure of kidney. Here is glomerular capsule, and here is a proximal convoluted tubule, and here is nephron tube, and here is distal convoluted tubule, and here is skeleton duct. When drugs filter through glomerular and enter into renal tubular, there are some passive tubular reabsorption and active tubular secretion. Renal excretion. Here is glomerular capsule. Here is proximal tubular. Here is nephron loop. And here is distal tubular. Here is skeleton duct. Excretion of drug and the metabolites in the urine involve three distinct processes. 1. Glomerular filtration. 2. Active tubular secretion. 3. Passive tubular reabsorption. The first factor influencing renal excretion is glomerular filtration. Renal function generally affects all three processes to a similar extent. In neonates, renal function is low, but mature rapidly within the first few months after birth. In adulthood, there is slow decline in renal function, about 1% per year. So, in elderly patients, there is substantial impairment in renal function. The second factor influencing renal excretion is active tubular secretion. Active carrier mediated tubular secretion also may aid drugs to the tubular fluid. There are three major transporters. 1. P-glycoprotein. 2. Multiple drug-resistant associated protein type 2, NRP2. They are responsible for secretion of amphipathic alanine. 3. ATP-binding cassette transporters, ABC transporters. It's more selective for organic cationic drugs. If two drugs are selected by the same active carrier, they could compete with each other to bind the carrier. I have given you the example in the previous episode. When penicillin used together with probenecid, they could compete with each other and prevent penicillin to bind to the carrier, so penicillin active secretion will be decreased. The third factor influencing renal excretion is passive tubular reabsorption. In the plasma and distal tubulars, the non-ionized form of weak acid and bases undergo net passive reabsorption. Passive reabsorption of this substance depends on the pH and pKa of drugs. We have discussed it in detail in last episode. We will not discuss here again.